So you've got gum recession around your dental implants. What can we do about it? Hi, my name's Gus. I'm a cosmetic and implant dentist based near London in the UK, and today let's look at recession around an implant. What recession is when the gum shrinks back. Okay, and this can make a tooth either look quite long, or in the case of implants, we can start to see some metalwork underneath the crown. So here's a typical example of what recession around an implant looks like. Now, it doesn't always look like this because here's another picture, but these are two front teeth, and one front tooth is noticeably longer, and that's the one with the implant, than the other one. And these are both of these cases are kind of caused by the same factors, but it's the same reasons causing them. And it's not the same reasons that you might get recession around a natural tooth. So as I've spoken about, loads of times in other videos, when we lose a tooth, when a tooth is removed, and let's just keep it simple and talk about the front tooth at the top. If that tooth was to be removed, what we can almost guarantee is that the bone is going to shrink back. And it's going to shrink up a little bit, but mainly back. And the temptation for an implant dentist, especially somebody who's a little bit less experienced, when they're tackling a highly cosmetic case like this, is just to put the implant in where the bone is. And if we look at a CT scan, we can see the angulation of the bone. Now, the problem with this is, if you put the implant in where the bone is, yes, your implant will be completely covered with bone and it will be a fantastically successful implant, most likely. However, our angle at which the screw hole is going to come through the tooth, so the long axis of this implant, isn't ideal. Okay, so what this means is, if we were to put a screwdriver in the end of the implant, and it would come out on the front surface of the tooth. And from an aesthetic point of view, we can't have a screw hole in the front of the tooth. It would look terrible. There's no neat way to fix that. Sorry, I should clarify. There's no neat way to fix that and still have a crown that you can just screw in and out. The old style of doing this, the way we would do it, is we would screw in the abutment as a separate unit and then glue the crown on top of that. And we still do that very occasionally, especially when I'm trying to kind of rescue a badly placed implant. Sometimes that's the only option that we've got. But if we're starting fresh, we always try and have everything in a nice straight line with the screw channel hidden behind the tooth. So this means we have to change the angulation to something that doesn't feel quite so natural. So the implant may not be fully covered in bone, and this might mean that we need to do some kind of bone grafting at the time of implant placement. For some people, cost might be an issue, and the cost of bone grafting might be a step too far. Either way, what happens is, potentially over the years, we've ended up with this implant which is too close to the outside surface of the tooth, especially where the neck of the implant is, and you continue to have a little bit of bone loss, and maybe you're brushing a little bit hard as well, just compounding all these factors, and the gum starts to shrink back, exposing the abutment and sometimes the implant as well. Now, this isn't the only reason we get recession. You can get recession in the kind of traditional way that most people get it around their teeth, and that is through gum disease. However, I think most people who have implants will have their gum disease controlled. And this is because most dentists are doing a decent job, and before they go in for the implants, it's really important that you have the gum disease completely under control. Now, when somebody comes to see me and we look at what's going on right around this implant, the first question I'm going to ask myself is it infected? So this picture here, you can see the implant, but the gum around the implant generally looks pretty good. And we have to ask ourselves, look, functionally, this is actually a perfect tooth. It doesn't bother the patient very much, actually, because their lip covers the metalwork. So here it's not that important, but in some cases it is very important, especially when someone smiles and you can see it all. Different people show a different amount of gum when they smile, and for some people, there's no way that this would be acceptable. Now, because it's not infected, right, that's one factor which is in our favor. I mean, compare that to this implant where it clearly doesn't look right. There's all this bacteria plaque buildup around this implant. There's loads of recession. We can actually see the screw threads of the implant, okay? And quite often when you get recession, you see metalwork, it's not the implant you're looking at, it's usually the abutment. But here, this is definitely the implant. Now, in an infected case like this, chances are we're not going to be able to keep this, okay, because we've got bone loss around the implant. And the second thing that I'm looking for is what is the pattern of bone loss around this implant. So in the first case we looked at, you can almost imagine, without taking a CT scan or anything like that, that the bone has only really been lost from the front of the implant. And that could be through aggressive brushing over years. It could be through natural bone loss in the normal pattern that bone is lost, which is, outwards in. And that would mean if we were to cut a flap, but what I mean by cut a flap, if we were to lift the gum, we would see that this implant is a little bit exposed, raised up around this bed of bone. Okay, and that from an access point of view makes it a lot easier for us to lift the gum up, clean everything underneath it, and then maybe even do a tissue graft or something like that, which I'll come back to later. I'll show you what we did in this case. We didn't fix it completely. Now, if we look at the case of the infected implant, it's a different scenario. Here, we've got an x-ray, we can see where the bone level is, we can see that there is no bone all the way around this implant. So if we were to lift the gum up and get visual access, it's going to be very difficult for us to visually access the inside surface of this implant and access it all the way around. We've got special brushes which are designed to disinfect a surface of an implant, because where we have bone loss and recession around an implant, we have an option of trying to kind of keep hold of it for as long as we can, or we take it out. The keep hold of it for as long as we can option is often the option that most of my patients will go for, because the factors are favorable, okay, and it avoids the expense of removing an implant, bone grafting, and new implants, and going down that route. So we have to analyze each and every case, and we have to look around the implant itself, because if I'm going to suggest something, I want it to have a pretty good chance of success. So if we've got active infection, like this case, or definitely if we've got pus coming out of the side of an implant like we see here, these cases are already on their back foot, and trying to rebuild around them or save these implants, there's no point in doing complicated surgery until we can get rid of this infection and see where we are. The way we get rid of the infection and see where we are is exactly the same way as we would do it with gum disease, normal gum disease. So you might have a couple of sessions with a periodontist to do deep cleaning all the way around. We might review it in 3 to 6 months. Make sure that you're able to maintain a relatively clean mouth and relatively clean area around these implants. The gum will probably shrink back. You'll probably get more gum recession around the implants, but we've got a better situation. Then we can look at what are we actually going to do about this. Once an implant surface is infected, it's very difficult to sterilize that again. It's designed to be very porous and rough because that helps the integration with bone, but it also harbors loads of bacteria. So one option is, if we're going to try and keep it, we lift the gum up, we clean the surface of the implant as best we can, and then I would typically do a gum graft to thicken up the gum around the implant, and that's what we did here. We cleaned everything up. It wasn't infected. It was only the outside bit of the implant was exposed, and doing a gum graft, we got this kind of result after it all healed, and a few years later it still looks like that. And this was acceptable for the patient, and for me I felt a little bit better because we had thick, what we call keratinized gum, which is the hard type of gum surrounding this implant, which helps protect the implant in the long term. Sometimes there's an active infection around an implant, and if there is still a decent amount of implant in the bone, we can still lift the gum, clean the infection, and some designs of implants are are specially designed so the roughness reduces near the neck of the implant. So the bit which is more deep in the bone is really rough, so we get the integration to bone like that, but the bit near the actual tooth is a bit smoother. So if we were ever to get gum disease or bone loss around an implant, we're able to lift it up. It's easier to clean a polished surface than it is a rough surface, and then we've got a better chance of success like that. So like I said, most of my patients who see me with this kind of problem, we try and save it if we can, and if it's not in that critical anesthetic place. If it's an aesthetic problem, typically people will find us earlier, because when it's a small problem, they'll come to us. Whereas if it's a non-aesthetic problem, things develop because it doesn't hurt, and life gets in the way, and we see the problem a little bit later. But if we've got bad infection around the implant, often it's just better to remove the implant and let the whole bone heal, and then you can consider your options thereafter. Usually we're able to provide some kind of temporary solution for a cosmetic fix, but these are never amazing. So just be prepared. If you've got recession, gum disease around an implant, and especially if it's active and it's getting worse, there is going to be a time when you lose the implant. It's better to have the implant removed because the bone loss around the implant will be a little bit less. Okay, if you just wait for it to fall out, it's only going to fall out because more bone has been lost. Now, you might think, why can't we do a bone graft around an implant? And this is a pretty logical question, but I would personally be very cautious of this. Bone grafts are very susceptible to getting any types of infection, and because we can't completely clean the surface of the implants, it doesn't fill me with hope trying to bone graft around there and then close all the gum around it. With a tissue graft, we're getting all the blood supply from your own gum. We're using your own gum, taking it from the roof of your mouth and putting it where we need to do it. And as soon as it's got blood supply, chances are it's going to be successful. So you've got a bit more flexibility. Even with a slightly infected implant, a tissue graft can work very nicely there. So I hope you found this video useful. If you've got recession around an implant, definitely get it checked out. And if your own dentist doesn't really want to do this, people who don't have a lot of experience are very scared by these kind of problems, go and see somebody who does. Do a Google search for local periodontists. Periodontists are probably the best group of dentists to see for this kind of problem, because they just deal with gums, and a lot of them place implants, and a lot of them are absolutely fantastic at doing this. So I'd suggest that as your first step, and maybe it's worth getting a couple of opinions from different clinicians as well. Okay, so I hope you found this video useful. I hope you got something out of it. Please remember to hit like or subscribe. We're trying to get these videos out a little bit more regular than normal. So until next time, guys, I'll see you soon. Take care.